we are going to have two major classification as the Bethesda system and the non-Bethesda system. This is nothing but, it is a system or it is a method of reporting the results of the cervical and the vaginal cancer screening. Say for example, in the Bethesda system, how they are going to report is, in case a person is negative or there is no cell abnormality, how the result would be, it says it is negative for intraepithelial lesion or malignancy. So this is how they report it. The result is interpreted. So it's just a variation in the way of reporting that we have as Bethesda and the non-Bethesda. So it's not just as cancer or screening of the vagina and the cervical region is done. Any such smear that you can take it, say the urine specimen or the blood specimen or the fluid specimen or sputum, saliva, anything can be taken for the sake of collection. Okay, the doctor is going to assess or look for any type of abnormalities in the cellular architecture. That's all it is. And we have various such techniques. One would be the conventional method, conventional or the non-conventional method, and then you can classify the entire cytopathological studies into various types as manual or automated, liquid based and automated liquid based. Manual, just by looking at it, a visual examination of it can tend to give you some idea of it. So that's going to be a manual study, cytopathological study. Next is automated. So you are going to make use of some devices, some electronic devices to arrive at the results. Next is liquid based. So you are going to mount the specimen on a liquid medium. You can add some fluids or add some reagents to it and then you can study liquid based, and then you are going to see for any cytological changes. And finally it can be automated liquid medium. So in the sense automated liquid based. So the same manual liquid based, it is being subjected to an automated test. So this is how you have various classification. So here, while reporting the codes, you need to know what exactly is a specimen here. Is it blood or it is a semen, or is it is a vaginal fluid or the cervical fluid, or it is a sputum, whichever it is. And what is the type of technique that they are going to do, whether it is Bethesda or the non-Bethesda. Accordingly, you can report it. And here you also need to report for the physician supervision if it is being done, or technician work is also there and the physician reporting is also there. Some tests might require the presence or supervision of physician. So accordingly, you can report the codes.